Welcome to A State of Mind. This is Julian Royce. Today's episode is one of my favorite in a long time. I am speaking with Erik Jampa. Erik is a trained Tibetan medicine practitioner. One of his teachers is Dr. Nida Chinangsang, among others, and he studied and worked at a Tibetan medicine clinic in Nepal for 6 months before moving to London, where he now lives and practices Tibetan medicine. And I am attempting to video record this intro as well as do the audio, which is new for me. Check out our YouTube channel, A State of Mind on YouTube. Let's see. We have a really deep, far-ranging discussion here, and Erik shares with us some really fascinating perspectives on coronavirus from the point of view of Tibetan medicine. We discuss karma, the ways that can impact their health, the role of trauma and intergenerational trauma, and we discuss the idea of free will and how that doesn't really make sense if we pay close attention to our own experience, especially when we consider all the causes and conditions and influences on all of our experience, all of our moments of decision making. We also discuss how humanity's interference with the natural world, including our air, our water, and in other natural areas, how this disturbance directly led the coronavirus, which we know probably came from a so-called wet market in Wuhan, China. And just the Tibetan medical tradition and Buddhism in general has some fascinating perspectives on the role of karma and the way in which our actions influence the world, but also influence ourselves. And one of the ideas that really struck me from this conversation is the idea of an intelligent kind of secular animism that respects all the different forms of life and intelligence in our world, partly through personifying them. And this was done traditionally in many indigenous societies, not just in Tibet. And when you personify something like that, you can then have a more conscious, more healthy relationship with it. And you also may be less likely to abuse and disturb and destroy it if you see it as a living being, as also possessing of consciousness and of life. And a fascinating example Erik shares about this with us is that of leprosy. And traditional Tibetan medicine saw leprosy as coming from disturbing the beings which dwell in the earth. And modern science has shown that bacteria which causes leprosy is found in the soil in certain areas where people can contract it from coming in contact with that soil. So that was just really fascinating for me. It's a really deep and rich conversation, and I hope you enjoy it as much as I did. And now I bring you Erik Jampa. Hello, I'm here today with Erik Jampa Anderson. Thanks for being on the podcast.
Yeah, thanks for having me.
And are you in England right now?
Yeah, I'm in London. I'm based in London.
Ah, it's amazing how well our Zoom connection is working.
Totally.
I've been doing Zoom calls with people who live down the street, and it hasn't been working very well. Now it's working great, so that's awesome. And we met at a meditation retreat at Tara Mandala, and then I saw you again at a Tibetan medicine Buddha retreat.
Yeah, in Topanga, in California.
Yeah, that's right. Yeah. Do you want to introduce yourself a little bit? I know you have a connection with Tibetan medicine, and
yeah, so I'm a Tibetan medicine practitioner by trade, and I teach Tibetan medicine and Tibetan Buddhism as well under Dr. Nida Chinangsang, who's a traditional Tibetan medicine doctor from Amdo, which is in northeastern Tibet. So I studied for about 5 years doing textual study with the Shangshung Institute in Tibetan medicine, and then I did a 6-month internship in Nepal to get clinical experience treating patients. And I've been practicing since then. So it's been a little over 2 years that I've been practicing mostly in Los Angeles and now in London.
Wow.
And yeah, I've been a Tibetan Buddhist practitioner for a lot longer, though. I've been a student of Lama Tsultrim since I was 14. So I sort of came up in the Dharma, and I was around Tibetan Buddhism for the majority of my life now. And yeah, the transition into Tibetan medicine as a career path was a very sort of organic, natural movement for me after previously bouncing around quite a bit and trying to find a place to sort of, have a seat and have some activity to do.
Right. 14 is young for a lot of people. A lot of
Yeah,
people, kind of discover it later.
Yeah, I had a nice sort of batch of existential crises when I was quite young, which led me on a sort of path of, trying to find a deeper sort of meaning in life. And that eventually led me to Buddhism. And as soon as I sort of encountered it, I knew that that was right for me. And Tibetan Buddhism in particular, it felt really, now I would frame it as being sort of a karmic connection, but I didn't really know that.
So it just kind of clicked with you and made sense.
Yeah, and I mean, I did a lot of exploring in the years leading up to it. It was really between like 12 and 14 that I studied a lot of, as much as you can at that age, studied a lot of different religions, trying to sort of explore different belief systems and views of the world and see what aligned most closely with what I felt to be true. Eventually stumbled upon Buddhism and didn't really look any further.
That's interesting. When you say existential crisis, what kind of things, like meaning, or what is the point of it all?
Like my brother was murdered when I was a child.
Oh, wow.
When I was around 9 years old. So I had a really early exposure to death in a very unnatural sort of way. And, had an early exposure to just the difficult side of life and impermanence. And obviously around that time, when you experience a death, especially when you're young, you start hearing a lot of different ideas about where they are now, and they're in a better place, and they're looking down on us, and all these sometimes sort of platitudes, but at least concepts of some kind regarding what happens after death and what the more sort of essential meaning of life is. But none of it really sat right with me, the way that things were explained. And it was really from that point that I started exposing myself a little more to alternative ways of thinking. I had already had a bit of a foundation in, strangely enough, sort of like Western esotericism, but things like, palm reading and tarot cards and, astrology to a certain degree. And I knew what those things were, but I didn't really have a sort of structure to place them in and to understand them in. So yeah, doing a bit more research still at a very young age allowed me to contextualize a lot of experiences that I had previously and sort of general feelings that I had regarding the nature of things.
Yeah, that's interesting to hear. I mean, often there is some kind of tragedy or crisis or something like that would lead someone to a path like the meditation path or the Buddhist path. Where are you at in terms of reincarnation? Like, is that something that you ascribe to?
I definitely believe in rebirth. I sort of place myself, it's weird because I'm not really in the middle of the two polarities of like traditionality and modernity. I can see myself as being really a blend of those two things as opposed to compromising on either side of it. I am a sort of traditionalist in a lot of ways, I suppose, but I'm also definitely someone who is more rationally oriented, scientifically minded, and I don't like to have any cognitive dissonance in whatever I'm doing. And I think that was a big part of also what led me to Dharma, was sort of the promise that there would not be any cognitive dissonance, especially coming out of the Christian tradition and feeling like there was a lot of it to go around. And I wanted to be able to immerse myself in something that I knew had a greater degree of what I felt was validity and rationality and, a more sort of scientific approach to spirituality. For me, rebirth is the most realistic. It's the most realistic system for life to exist in. If you consider the fact that, if mind is something that akin to matter and energy can't really be destroyed but just changes form, I think it makes sense that it would manifest in different ways in a sort of sequential manner. Also, when you just take into consideration the basics of karma being the cycles of cause and effect, it would be unrealistic sort of to have something arise out of nothing in that way, for the momentum that takes place during life to have arisen from no causes.
Right.
At the same time, though, I also think that the way that we understand karma and rebirth can also be tied in certain ways to like our genetic history, and previous lives can also be explained, at least in some way, in the experiences of our genetic ancestors, which provide these sorts of karmic imprints, if you will, on our genetics and on the way that we view the world and the way that we experience certain preferences and desires. Those are also things that are cultivated in previous lives, even though it might not have necessarily been ours. And it affects the way that we view the world. It affects our karmic vision.
Yeah.
So I think there's a lot of ways to view those things.
Thanks. Yeah, I appreciate that. I mean, I remember when I was like really kind of wrestling with this question more, this idea that like a moment of mind can't just like nothing, there's nothing in the universe, like you just said, where something just becomes nothing. So why would our mental phenomena, why would our moments of mind suddenly become nothing? They must make sense to me that they would continue in some way. And then when I got to live in India and Nepal for a while, and when I was there, I really did kind of believe in reincarnation. And now being back here, I'm not sure if I do in the same way. Or like even if our mind continues on, I don't know if it's the case that it would necessarily be born, like your great grandson or something, or like in this world, like maybe there's other worlds that it could go to.
Yeah, I mean, for me, it really comes down to sort of looking at the alternatives. I think it's extremely unrealistic that we live one lifetime and then we go off to some sort of eternal paradise or damnation. Obviously, that's an extremely unrealistic sort of version of the universe. But equally, I think it's quite unrealistic that we just, we live a lifetime and there's all of this sort of experiential phenomena. And then as soon as our breath ceases and our brain dies, all of a sudden that's the end of consciousness. I think it makes a lot more sense. Actually, from an existential sort of perspective, I think that it would be far more preferential for that to be the case, for the latter to be the case, especially if you adopt other aspects of Buddhism that imply that all experience is ultimately suffering. Even positive experiences, due to their impermanent nature, lead ultimately to an experience of suffering. So from a really more somewhat, I guess, nihilistic sort of, existential position, it would actually be a hell of a lot better if death was the ultimate emancipation from suffering. It would make things a lot easier, and it would be, a lot less of a struggle, because there would just be once you die, it's over. So it really sort of my current conviction of rebirth as being the mode of existence for sentient beings is really arising from the unrealistic qualities of the alternatives.
Right. Okay. That's interesting. I mean, the other thing that I thought about when you were talking is intergenerational trauma. And that's something I've been thinking more about and see more in my work as a therapist, and then in my own family. Like if something really traumatic happened to your grandmother, for example, it could often skip a generation, but then the grandchildren might feel that, might be affected by that. And there might not be any real rational reason. Maybe the rational reason is what happened to their grandparents, and it actually gets passed down through hormones. Like there's actually scientific evidence showing the changes that can happen there.
Totally. Yeah, I mean, that's so much of just human evolution. And it's sort of what I was talking about regarding, it's sort of my more rationalistic sort of physical understanding of karmic traces, or sort of karmic vision, and the way that these impact us on a very sort of physical evolutionary level is basically that what our ancestors did leading up to us for the past 100,000 plus years of sort of modern Homo sapiens. And far beyond that, our very oldest genetic ancestors, all of their experiences have affected them to some degree genetically. And those end up, sort of rolling downhill into our experience. But, even our if you have an addiction to sugar, or if you have a really difficult time controlling yourself from, eating a whole box of Oreos, that's not necessarily out of step with evolution. That arises because, we have ancient ancestors who didn't encounter natural sugars very frequently. So they had a natural tendency, if they found sugar, a tree full of fruit or something, they'd eat as much of it as they could immediately because it wouldn't keep for very long. So that's really, an evolutionary sort of biological impulse that has then affected our ability to control ourselves in the face of an Oreo box. And, we may think of being an aspect of, it's free will. I actually have the ability to choose whether I want it or not. Or it's based in these, very temporary circumstances, but really it's based in our ancient genetic biological history. And I think that's an interesting way for us to contextualize the sort of karmic traces in our karmic vision as well, in remembering that it's actually a much grander arc that we're looking at as far as the influences that impact the way we view the world and the way that we behave.
Yeah, absolutely. I laughed when you said free will because I've thought a lot about that. And it's just kind of a concept that kind of breaks down when you think about it, because we have this idea that you have free will to choose between A or B, but it's like, why are you even wanting the thing that you're wanting? Like with sugar, for example, it's a great example. Yeah.
Totally. There's no, I'm convinced that there's no Buddhist rationale for free will. And it's unfortunately something that there isn't a lot of Buddhist literature on. There's sort of similar mentions in sutric literature that seem to imply that we don't really have free will ultimately, but we should act as if we do. I can't quote the sutra specifically, so please don't ask me to. But when you receive teachings from lamas or from teachers, or when you read, traditional literature, you don't see any references really to this idea, because it's ultimately it's a Christian creation. It's a Judeo-Christian sort of concept that humans are endowed with this free will by the Creator that comes along with the soul.
Yeah.
And
it assumes an individual being acting freely in a world that's separate from itself, and that's not what. I don't think that's what our reality really is.
No, exactly. If you have free will, then there has to be an agent, and there's no rationale behind the existence of an agent according to Buddhist philosophy. And it just breaks down in the face of karma as well. And it's on, both on the level that I was talking about with like sort of biological karma, but also on just mundane sort of, this life kind of karma. You don't even need to consider past lives really to understand that every decision that we make is based on previous experiences, based on what we've been told, or what we've experienced, or what we've been taught, or what we like or dislike. And then there's going to be biological factors of what we enjoy, what brings us pleasure, what brings us pain, what interests us, what doesn't. All of these things are going to impact every single decision that we make. Every word that you choose when you're giving a speech or something is going to ultimately have a root in something other than just your agency and your magical will. It really, I think it also harkens to the sort of Buddhist notion that karma really affects us like fish on a hook. That's an old analogy for our experience of karma, that we're really just pulled around like a fish on a hook. And when they say that, it's quite straightforward. That fish doesn't have any agency. The fish isn't really choosing where it's getting, pulled to. As long as we're being driven by our karmic impulses, we don't really have free will to make decisions out of our own volition.
Right. Well, maybe one way to understand the path of meditation is it helps you to have more freedom to actually choose from a deeper place, rather than just, because we've been kind of programmed like you were just describing. And one of the ways that I realized that really struck me was anthropological studies of different cultures and their ideas of beauty, like sexuality, like the kinds of women that men find attractive and how culturally influenced that is. But you don't feel that in your personal experience. You think you like that because that's what you like. You don't realize how programmed we've been.
Yeah, and it's one of the ways that you really get to see some of the subconscious workings and even like neurochemical workings of things like attraction, which is really primal, from a Buddhist perspective and a Tibetan medicine perspective as well, of the three poisons, the three primary afflictive mental states. Desire is one of them. And that's really acting, when you look at human attraction, if you're attracted to someone and when you decide to, become sexually involved with them, for instance, that's based in so many biological, psychological, sociological impulses that we're completely oblivious to. There's no way that you can really rationalize why you would, want to have sex with this one person and not with this other person. But it comes down to so many different things that our brain is processing really under the surface that we have no conscious agency in. And it should really go to show us that we aren't really in control of our brains. We're not really in control of our experiences, which is part of why circumstances are so dangerous today, because we're quite vulnerable to different kinds of infiltration from a lot of different sources that want other things than just our well-being.
Absolutely. Yeah. Well, that kind of brings us to one of the topics we're going to talk about was coronavirus. And how have you been doing with all of that?
It's stressful. It's stressful circumstances. I think the political clusterfuck has made it a lot more difficult to deal with.
Yeah. So you're in England, and your Prime Minister Boris Johnson has it, right? It's pretty wild.
He has it. He just left the hospital recently. He was in intensive care for a couple of days. He spent 2 or 3 nights in intensive care, and it's a really the whole thing is really surreal and just bizarre. Everything feels quite, sort of it feels a bit apocalyptic, not because of the extremity of it, just the strangeness of everything, the absurdity of it all, and sort of the compound nature of everything happening at once. But it's certainly really difficult times. Unfortunately, the UK and the US are not really making things much better. There are a lot of issues in a lot of countries, but especially the US and the UK, regarding testing, regarding accurate reporting, access to medical care for people. I have friends who work in the NHS here, in the healthcare system in the UK. And they report absolute horror stories from the front lines. Not just the sort of visceral terror of people, dying of this disease, but also, NHS workers, doctors who are denied tests, who are told that they should just go and stay at home for a week and try to self-isolate, but they're not given any sort of tests to determine whether or not they have the disease.
And that's because there's not enough testing?
There's not enough testing, and the criteria for getting a test has been extremely limited up until this point. And it's still quite limited. There's still people in the US and the UK who need tests and just are not getting it.
Yeah.
Now we finally have some sort of movement where people who are, in caregiving positions or who are vulnerable can have access to a test and find out if they have it. But it's really, it's a lot worse than it looks.
It's really outrageous that we don't have the ability to test doctors and nurses who are treating people, potentially passing on coronavirus to the people they're trying to treat.
Yeah, I mean, a friend of mine is a doctor he works in a cancer ward. He's an oncologist, and he was being refused testing, even though he had colleagues that he was in contact with who became positive with the virus. And he basically decided to call in sick for a week. He said that he was exposed, so he was going to stay home, but he just wanted to wait and see and make sure that he wasn't infected. And he still has some symptoms, but not the textbook cough sort of symptoms. So he was refused a test on those grounds because he didn't have the textbook symptoms.
Well, and are you?
Sorry, go ahead.
I was just going to ask are you under lockdown right now? Like, are you able to leave your apartment? And
yeah, in the UK, you can leave your house once a day for essential errands like going to the grocery store, or if you need to work, if you're in an essential work position, then you can do that. Otherwise, you can leave your house once a day for exercise. So that's the current law, which a lot of people still feel is a bit too lenient. Unfortunately, a lot of people are still going out and sunbathing in the park and, socializing. And it's not really, it hasn't been quite, unfortunately, draconian enough to really get people to stop going out of their house unnecessarily, as opposed to places like Italy or Spain, or France, where they have much more stringent lockdown measures in place.
So sounds like you're really in favor of more stringent measures. Do you fear that the situation in the United Kingdom will get worse because there's not been more strict measures?
Yeah, it already is, unfortunately. We have one of the worst, if not the worst, death rate in Europe. It's really difficult to know exactly how many people are infected because of the low degree of testing, low volume of tests that are being administered. So the situation in the UK is really quite dire right now, especially in London. There's a lot of people dying, both in hospital and at home, and not a lot of people being tested. So it's definitely, unfortunately, it's going to get worse before it gets better. And I am certainly in favor of more stringent measures to have people locked down with some sort of caveats. Ultimately, I think this is the best opportunity for us to instate measures like universal basic income. I think this needs to be a moment where we reevaluate what people need to survive and how we support people through increasingly sort of uncertain circumstances. And especially as we're looking at a future that's going to be much more populated by these pandemic viral outbreaks. All of the science is showing that these zootrophic diseases that are related to human encroachment upon natural environments are being caused by climate change, by environmental destruction, and that these are increasing. I believe it's 3/4 of all new infectious diseases are zootrophic. They're animal-based, and they're entering into humans through environmental destruction, things like deforestation.
Right. Well, talking about karma, I mean, that's a good example.
It's karma, but it's interesting. I've seen actually a couple of lamas talk about coronavirus as being a karmic disease, and I actually disagree with them pretty fundamentally on that. It is everything that we experience is karmic. So yes, it's a karmic disease to some degree, but from a traditional Tibetan medical perspective, there are certain diseases about. It depends on what sort of categorization you're using, but around 1/4 of all diseases are considered to be karmic in nature. And these are diseases that usually have some sort of a genetic component. They're usually chronic or terminal, and they're not really treatable. You can only pacify some of the symptoms and help to, sort of palliatively, you can take care of it, but you can't cure it. Diseases like this, infectious diseases, which we call rhimne, are actually sort of caused fundamentally by provocation, or dun in Tibetan. And this is a distinct category from karmic diseases. A karmic disease is really something that arises for an individual based on a previous string of karmic occurrences for that individual. So it can be something usually related to previous lives, or like I was talking about, if there's a genetic component, you can also understand that on a physical level as being something that's passed down genetically.
Right, but like a predisposition.
Yeah, exactly. But a provocation-based disease is slightly different, and an infectious disease in particular is sort of a special manifestation of provocation. So it's really arising from our collective damage that we are inflicting upon the natural world. So pollution, primarily in the case of COVID-19 and these sorts of infectious diseases, it's usually tied to air pollution. So, burning a lot of toxic substances, releasing carbon into the atmosphere is ultimately considered to be sort of the root of all of this, which then affects a certain class of beings that exist in the atmosphere, and then they release viruses, which then fall to the earth. And
that's fascinating. I haven't heard that before.
Yeah, this is the sort of traditional Tibetan understanding of viral epidemics. It's really considered to be caused by a host of, or a sort of class of dakinis, of Kandrama, that are mamos, known as mamos. And a lot of people have heard about mamos if they're in the Tibetan Buddhist world. But they're really just this class of basically sky-bound female spirits. At least that's how they're personified and understood. But they're these energies that exist in the atmosphere, and they're affected by environmental pollution. There's a lot of other beings that exist in the Tibetan sort of, animistic world that are connected with forests or with water or with the regions under the ground. And as each of these areas of the world are decimated and desecrated by humans, the beings that inhabit them become upset or ill, and they can inflict illness upon humans.
Right. Well, that's fascinating, and it's a great window into Tibetan medicine and how different perspectives are there. But I also think like that, like you were saying at the beginning of our conversation, there are a lot of bridges between modern science and some of these traditional understandings. Like perhaps there are energies that are existing that are then personified in certain ways, but they're not exactly like, some woman living up in the sky. It's like there's some system happening there. When we disturb it, it affects us as well.
Exactly. We can see it's a fact that viruses fall to the earth from the atmosphere. There's a specific level of the atmosphere, basically between where clouds form and weather systems form and where planes fly. And there's literally countless viruses that exist within that level of the atmosphere. It's not actually known scientifically where they arise from, whether they, some scientists believe that they begin on the earth, they're swept up into the atmosphere, and then they travel long distances up on that level.
Wow.
Others believe that they're actually sort of born in that level of the atmosphere, and others believe that they are sort of sent into the atmosphere from outer space. These are three distinct groups of, like real bona fide scientists that are trying to understand where these viruses come from. But they fall, hundreds of millions of viruses fall onto each square meter of the earth every single day. And that's, it's the way that modern science understands something that traditional science has been talking about for a very long time.
Well, that's fascinating. I've never heard that. Where can you say again where in the atmosphere this is?
It's basically between where weather systems form and where planes fly.
Oh, wow. Huh.
So that's, a great sort of example of how traditional science was pretty spot on. There's another great example that I like to use, and this is for leprosy. So leprosy in traditional Tibetan medicine is usually associated with a disease called dzene. And this is connected to nagas, or lu, which are these chthonic, underground, subterranean spirits that exist in water sources and also under the actual earth and the soil. It's believed that they have very complex societies that exist under the ground. And one of the activities that's considered to provoke these lu is digging at the earth sort of without taking proper precautions and doing it at the wrong times in the wrong places and basically taking what was below and bringing it to the surface. And it's believed that this is sort of the ultimate human cause of leprosy, which can then be transmitted from human to human after someone has caught it. And leprosy actually is caused by a bacteria that lives in the soil, and you can catch leprosy from exposure to the bacteria directly from the soil. They found that in places where people still get leprosy, if they test the soil near those people's homes, it usually does have this bacteria in it. And the pathways by which leprosy is transmitted from human to human are also a little bit atypical, apparently. I'm not a Western scientist. I don't understand.
That's amazing. No, it's so incredible. I love that story or that information. I never heard that before.
But I do think it's important from my perspective, there's a big difference in the way that we can process information if we're using a sort of Western scientific modern worldview versus a traditional worldview. And I do actually think that there's a lot of benefit to sort of personifying these sorts of forces and relating to them on a much more sort of human level. And this really comes back to our evolutionary biology and why we do things the way we do. Really, the whole reason we even developed complex language skills in the way that we use them was not to identify external physical phenomena. It was to relate with other humans. We didn't develop complex language to be able to explain that there's a lion, 3 trees away across the river. Other animals can do that already. Other animals have the verbal capacity to be able to express, those sorts of very mundane details about the world around them. What we achieved with linguistic development was the ability to talk about each other, to gossip, to, share stories, to share imaginative sorts of realities, and to share fictions. That was really our greatest benefit as Homo sapiens, and why we were able to wipe out all of the other hominid species and survive for so long. And I think that it's important when we sort of look at our current existential crisis with climate change, and when we realize that very little is actually being done and we're not getting very far, that maybe we reframe things and look at it slightly differently.
Yeah, no, I appreciate that a lot. I actually had in my notes before this podcast to talk with you about relationship, because in psychology, relationship is number one. I mean, that's what a lot of therapy work is. It's like improving your communication, improving your relationships, and it has very clear effects on our physical health. And so when we study something like our immune system, people who are in good community and have good relationships have stronger immune systems. And people who are isolated and who feel cut off or alienated or alone, they have, they're less likely to live as long. They're not as happy, generally speaking, and their immune system is more compromised. So there's a lot of connections. And a lot of Tibetan Buddhism, like what you're speaking to, is about relationship. It's about relating.
Yeah. I think it's a really essential part of, even just something as simple as sort of the contextualization of pollution and climate change and environmental destruction. And, for instance, there was a study done where they presented people, they had sort of a test group, and they presented people with two different scenarios to raise money for starving children in the developing world. And one presentation involved the story of one individual child, and you learn her name, you learn her story, how she was brought up, you see her experience. It's a really, a really personal experience that you're having with another human being, really seeing this personal appeal. And they did another presentation that involved a somewhat similar approach, explaining that there's all of these children that are dying of starvation in this developing nation, but it was much broader. They explained that there's tens of thousands that are dealing with this, and they all need your help. It's really important. And this was presented with a lot of facts and figures and data points and statistics. And ultimately, they were able to raise more money for the single child than they were for the entire group of thousands of children who are struggling. And I think that really speaks to our basic tendency to really relate a lot more with individuals and with these emotional sorts of relationships, as opposed to statistics and facts and figures. So when we look at the impact of consumption or carbon emissions on the environment and on climate change, and we're just looking at a lot of statistics of CO2 in the atmosphere and how that's jumped in the past 30 years and so on and so forth, it's really not even close to as convincing as explaining to people that we exist in a sentient universe and a sentient world system with a lot of different manifestations of consciousness and life that we aren't necessarily privy to. And by engaging in the way that we do, by polluting the water, by polluting the earth, by polluting the air, we're actually damaging and harming and killing actual living beings who have feelings and thoughts and that we relate to on a daily basis without knowing it. So it's my sort of hypothesis that if we change our rhetoric, if we change things from a statistical sort of approach to a relational approach, that we'll actually see more significant change in human behavior.
I think that is fascinating. I think that you're onto something there, because I've been thinking a lot about climate change ever since coronavirus really hit the fan, because if we collectively are this unprepared to deal with a single pandemic that scientists were warning us about 10 years ago, 8 years ago, 5 years ago, and we all know that scientists have been warning us about climate change and that's approaching, that's on the horizon, that's coming towards us, and we're not prepared. And I think what you're saying is fascinating. If we can relate to it more personally, rather than these big numbers that they fly over our head. We can't comprehend it. It doesn't affect us emotionally. Maybe that's another way to say it.
Yeah. And it's just not what humans are good at. Certain people get an emotional high from analyzing statistics. And for those people, facts and figures are going to be really persuasive. But for the average person, it's really not going to do much. You need to have a personal appeal. You need to have some sort of a relational understanding of why it matters for us to take care of the world around us. Especially when the numbers are so staggering. I mean, we're just 2 of 7 billion people on the planet.
Right.
There's no way to really comprehend that number, let alone the impact that we can have on our environment. So I think we need to change our approach to what I call like secular animism, which is how I identify the way that the Tibetans deal with this, and the way that they view the world around them. It's not divine in the sense that there's a god or the beings that inhabit the sky above us, or the nagas or the nyen or any of these different beings are gods, that there's some sort of divine beings that we have to worship. They're just like us. They're manifestations of consciousness of life that are not carbon based. We have plenty of scientists that are looking to other planets for potential non-carbon based life forms, but we don't think to look in our backyards where there may also be some non-carbon based forms.
Oh, interesting.
That we.
But what about the virus? What about the virus itself? Do you think it's conscious?
No, not necessarily. Within the Tibetan medical tradition, the beings like the mamos that are connected with the virus are considered to be sort of the negi dak. They're the holders of the disease. They're the sort of the stewards of the disease, if you will, but they're not the disease itself. So the virus itself is a microbe, it's a microorganism that is sort of brought to us by the mamos, or it's inflicted upon us by the mamos, but it's not the mamo itself. But based on just sort of a microbiological view of a virus, it doesn't have the trademarks of a living organism. But I suppose that could be up to interpretation.
Yeah, it's an interesting question. Well, in terms of your work as a Tibetan medical doctor, is that what you would call yourself, Tibetan medical doctor?
Because of the law, no. Okay. Really, no Tibetan doctors should be calling themselves Tibetan doctors. If you practice medicine in the US or the UK or really anywhere, and you call yourself doctor or something, then you're opening yourself up for a lot of trouble if you don't have an MD.
I see.
But yeah, I'm a Tibetan medicine practitioner.
Well, from that perspective, I don't know, can you share a little bit about how people could respond to the coronavirus, or just general advice for health in general?
Yeah, I mean, I'm a big fan in personalized approaches to medicine, which is really where Tibetan medicine is its strongest. So for every individual, it'd be good first and foremost to. Well, let me go back. First and foremost, for everybody, behavior needs to be the primary form of prevention. So we need to be isolating. We need to not have contact with people that are not part of our households. It might sound and feel really draconian, I think, especially for people who are in the US who haven't yet had the full wide-scale lockdowns that we've had in Europe. But it's really vital. And it needs to happen immediately, and it needs to happen until we have some sort of either really wide-scale testing, or we have some degree of herd immunity from widespread vaccination. Those are really our only two outs at this point. And until then, in order to protect the most vulnerable among us, and even those of us that don't realize that we're vulnerable, it's important for us to isolate as much as possible. So behavior, first and foremost, is the most important form of prevention. And on top of that, on top of isolation, if you do go into public for some reason, then it's really important. Obviously, wash your hands, don't touch your face, don't touch your eyes, other mucous membranes around the orifices, and just be extremely cautious with those sorts of behavioral things. But then, the sort of more standard alternative medicine practitioner answer, would also be nutrition. Nutrition is extremely important, but it's also very individual. So depending on your own individual constitution, it's good to eat a diet that's going to be pacifying for any sort of excesses or imbalances that you might have individually, on top of making sure that you're getting, enough fruit and veg. You're not eating a lot of processed sugar, not drinking a lot of alcohol. There are certain, certain things that everyone can observe and have it be effective and helpful.
Right. And then not smoking cigarettes. Cigarette smoking has been linked to people dying from this, which is, terrible, but also makes sense, unfortunately.
Absolutely. Behavior, obviously avoiding behavior that's going to be damaging to the immune system, and especially the respiratory tract. And then also engaging in healthy behavior, things like yoga is really helpful, especially if you're stuck at home. Doing a bit of cardio, if that's something that your body type really needs, then it's also really helpful. And obviously the stress component is a real thing that needs to be addressed.
Yeah.
But I'm a little bit reluctant, and I think because so many people have been focusing on the don't freak out sort of message, that I'm intentionally staying away from that. I think that there's strategic and mindful use of freaking out that we actually need right now. Seeing how many people aren't taking this seriously, really insane number of people don't even believe that this is a serious or a real disease. There's actually a number of folks, in the US that think that this is a politically derived, hoax that the Democrats cooked up to try to, hurt Trump. There's other people that think that this was created in a lab by some foreign government, either by China or by the US. There's people that think that this is all a hoax so that Bill Gates can sell a bunch of vaccines. There's a lot of conspiracies surrounding this, which I think is partially... What was that?
Well, I was just going to say, for better or worse, I have friends who believe some of these things, and I've been talking with them about them. But it's just ironic to me that in America, there's such an anti-government sentiment among people. And yet we tend to elect politicians that are anti-government. So we kind of have an anti-government government. And, if you look at Trump's response to this, it was very confused and unhelpful. And then when the government does tell people not to go outside, there's this knee-jerk impulse, like, I want to rebel against that. Like, don't tell me what to do. I'm an American. And when I go outside in my neighborhood now, I see everyone wearing masks, and I've seen multiple people walking around with guns, just walking around the street. And it's bizarre, but that's what I've seen.
That's crazy. It's so unconscionable now being in the UK. My husband, we were reading an article about people going and buying guns, in bulk, basically, people rushing to the gun store to prepare for this. And it's just absolutely mind blowing to any European or any British person that people would do that. And that's even a possibility. But it's definitely, it's the same for some friends of mine here who, they're very much against the Tory government. And they're very much for, the rights of individuals and healthcare and things like that. But when you deal with something like this, where essentially the necessity is that people are locked down and that they don't go out of their houses. Unfortunately, most people don't want to do that, and they're not going because they're told to. So then you need to put some sorts of restrictions and make it illegal for people to go out of their houses unnecessarily. Then you stoke this reaction of, oh, this is venturing into fascism, and they're telling us how to behave and taking away our personal liberties. So we need to rebel against that by going into public and socializing. I've seen really similar behavior actually between sort of the anarchists in the UK and the conservatives in the US, where they're all taking this, rebellious sort of approach to it. But it's definitely not a good idea. But at the same time, it is interesting when you look at like Israel and Hungary. The presidents in both of those countries have basically assumed absolute authority during this crisis. Oh, wow. And it's ongoing. It doesn't have an end date in sight. And these are the sorts of things, even Trump has toyed with the idea that he has absolute authority during this crisis as the president. And these are really dangerous. And unfortunately, these sorts of crises are often the instigators for major political change that ends up usually leaning more towards right-wing fascism. So we do have to be careful, but at the same time, we can't sacrifice the health of ourselves and our loved ones by making poor decisions and going out into public. I think that we need to find a middle ground where basically we stay home to protect ourselves, but we also need to demand that our governments provide us with universal basic income, widespread testing, and other resources in order to make sure that people aren't, needlessly suffering and starving during this crisis.
Yeah, absolutely. I mean, my hope is that we come out of this and really reform our medical system here in America. Ideas like universal basic income are good. I mean, there's just so much that we could remake society in a better way. That's my hope. I don't know if that will happen. But it also just feels like, how do we deal collectively with a crisis, with an emergency? And we see people rebelling, and we see, and there's some health to that, because we don't want to just follow the orders of the leader.
Exactly.
But, yeah.
But yeah, we have to remember that we have to be able to rationally look at things that are being put in place and see who they're benefiting. Ultimately, staying home and not going to work and not engaging in the economy is not benefiting the corporations. It's benefiting us in our personal health. So the fact that it coincides once in a blue moon with government policy doesn't mean that it is itself a folly. It's not a bad idea for us to follow that guidance, and it's actually giving us the opportunity to step back and reevaluate these really broken systems of what it means to be worthy of life in our society. So, questions surrounding employment, the future of work, the future of currencies and the economy, these are all being brought into the frame now, and we can look at it objectively and consider other options. But it really needs to be driven by the people. And unfortunately, in the US, frankly, I don't think there's any hope left. The hope is gone. Trump is going to get 4 more years in office, and there isn't going to be the opportunity for incremental government-led change. There's only going to be the possibility for radical revolution, and that's really where we're at right now. And unfortunately, the U.S. is leading the U.K., so we're affected here also by the same political dynamics, and the rest of the world is going to be affected by it as well. But I think that we need to take this experience and use it as a blueprint to understand that, one, change is possible. Radical, revolutionary change can actually take place overnight. It is feasible. And two, we have some sort of an idea of how that would look. And we know which things, isolation, of course, is not a necessity for, climate action. Really, organization, community bonding is more important. But we know that we can, stay home and demand that our governments provide us with relief packages to make sure that we are able to feed ourselves, and force our governments to demand that no one can be evicted, as they've done in France, or in Italy, demanding that all sorts of loan collection or debt collection is stopped, as in Italy.
Yeah, well, that's a bleak view of the United States. Hopefully, won't turn out that way, but I've been feeling similarly, and a lot of my friends too. Like, once Biden is the nominee and it's Biden versus Trump, it's like, it's hard for me not to think that Trump is going to win that election and it's going to be disastrous.
Exactly.
The other thing I've been watching is this thing around rent. Like, we have a really inflated real estate market here. Many people are renting. Many people have lost their job because of the government shutdown. And so I wonder what's going to happen in a month with rent here. And there's actually been a lot of corporations who have just said they're not paying rent on their stores for the next couple months. But individual people don't have that luxury.
Yeah, it's happening a lot, unfortunately, where even if the local governments, like the state government, has said that people need to stop collecting rent or stop, demanding rent from their tenants, that people are still doing it. Landlords are still doing it, and it's putting people in really difficult circumstances. It definitely, I was really fascinated actually to learn that in France, they actually have a law that every winter that no evictions can take place. A landlord cannot evict a tenant during the winter months. They can only do it during fair weather months. And it's really unconscionable that we don't have anything similar to that in the UK or in the US. It's absolutely not a guarantee that you will have a roof over your head during the times when it's most necessary. So, these sorts of things, we need to instate them during coronavirus to protect people now. But we also need to consider the fact that these are basic necessities for human beings, and especially those living in difficult times, which we very much are.
Right. Like, we need to provide the basic necessities for everyone, just in general.
Exactly. And another important area, I think, is just the future of work. When we're already dealing with a reality in which a lot of people's jobs are going to be replaced by automation in the next 10, 20 years, and increasingly more and more of our jobs are going to be replaced by automation as we move forward. So looking at this dynamic of like essential and non-essential labor, and also for a lot of people that work in offices 9 to 5s Monday through Friday, realizing that their jobs can be effectively executed from home in a few hours a day, is going to be really radical. And I think it's going to be both a good thing and a bad thing. It's going to force a lot of companies to decentralize their activities, their operations, have people work from home. But it's also probably going to reduce the amount of compensation that people receive for their jobs and the number of jobs that are available. the economy is definitely going to change after this in a lot of ways. And in order to prepare for that and preempt the fact that really this was inevitable anyway due to automation, I think we need to also take this as an opportunity to see, okay, what happens when suddenly people are unable to work? And what does that mean for humanity? You know, how does that affect people's ability to afford healthcare, as in the US, where health coverage is very much tied to employment? And even how it is in places like the UK or in Europe where you have socialized medicine, but it still is affecting, obviously, our very means of survival and paying rent, paying for food, and being able to exist in society.
Yeah, absolutely. I wonder if, to take a bigger perspective on it, like this idea of like creating a society of greater happiness, genuine well-being. I mean, when you look at Tibet, for example, because you have studied that a lot and been immersed in some more like different kinds of communities, like maybe at Taramandala, like I think like we have this idea, we assume that we're progressing constantly, that our society today is the best it's ever been, and that we're moving towards something better. And we kind of, I think, assume that people in the past were less healthy, they didn't live as long, they weren't as wealthy, they didn't have all these material goods that we have today, so today we're better off. And I've recently just really begun to question that in a deep way, you know, and I wonder if you went to some more traditional societies, like there are things we could learn from them. Like maybe there's some ways in which they're actually healthier than us. And I don't think it's necessarily true that people didn't live as long in the past.
Yeah. No, it isn't. The thing that people often forget is that life expectancy is it's a median.
Mm-hmm.
So it's an average that's taken of, a group of people, obviously, but a lot of people died very, very, very young in pre-modern times.
Right.
And that takes down your life expectancy quite a bit.
Takes down the average.
Yeah. So, you might say that a traditional society had, life expectancy of 40 years old or lower, but that's largely because maybe 60% of their young died before the age of 3, or maybe 75% of their people died before the age of 10. And when that's the case, your overall life expectancy is going to be obviously a lot lower. It is true that we today are living in we have less infectious disease, ironically, than we've ever had in human history. Less people die of infectious diseases today than they ever have, at least since the dawn of the agricultural revolution. And that is important for us to recognize and see that we actually have made some incredible strides in regards to, quelling, massive infectious diseases in the world. However, we have more chronic diseases that are, dietarily based. On the other side of like malnutrition, we have more people dying of eating too much and eating too much wrong things than we do people who are dying of malnutrition. And that's a really unique sort of circumstance. And we can't really say that we're a lot better off because of that. It's just different. They're different circumstances. I would definitely say that the traditional cultures that I've experienced, it's a mixed bag. Every experience is quite different. You have places like Bhutan that really, prizes itself as being a land of gross national happiness and, care for the environment and its people. And they still have a lot of problems. They have a lot of xenophobia. They have issues with immigration. They have a lot of misogyny. They have homophobia, transphobia. They still have some issues, mostly social issues. It's very much not perfect, but it's a good starting point. It's a good way to sort of think of things. When I was practicing in Nepal, when I was doing my medical internship, I definitely noticed that of all the patients that I saw, which was, sometimes 60 or 70 patients a day, we had a lot of people come into the clinic that I was working in. And the vast majority of them had issues that you wouldn't necessarily see as a traditional medicine practitioner in the West. People who are dealing with diabetes, that are dealing with cancer, that are dealing with very extreme sorts of illnesses, or even just average infections like cold and flu, or what have you, that you wouldn't necessarily see in a clinic for alternative medicine in the West. You're usually dealing more with chronic diseases, digestive issues, insomnia, depression, things like that. That being said, even though a lot of people had very severe pain issues, they might have severe joint pain, or might have some severe sorts of inflammatory conditions. Very few of them were psychologically affected by it in really serious ways. We would ask people if they were depressed, if they had a lot of anxiety, if they worry a lot. And most people said no. The majority of the people that I encountered said no. They were fine. Even if they were in pain, even if they were ill, they were generally okay. They had their family, they had their community, they had their practice, whatever that may be for them. They were, fairly supported by their community. On the flip side, my experience of practicing in Los Angeles, for instance, was that 75%, if not more, of the patients that I saw, they have some degree of mental, I won't necessarily say mental illness, but of psychological symptoms of like anxiety and depression that are really significant enough that they want some sort of treatment for it.
Yeah, that's so fascinating. I see so much trauma and addiction and like just really, I think there's just a tremendous amount of anxiety, a tremendous amount of depression, a tremendous amount of really broken family dynamics and lack of community. That's what I see in my therapy practice. Obviously people seeking therapy are going through something or they wouldn't be doing that. But I think what you're saying is really significant. It's just fascinating to me. It's these different cultures, but that people perhaps are more psychologically healthy in more traditional societies is really significant. I don't think we should dismiss that at all.
No. And at the same time, I don't want to sugarcoat, these specific societies and sort of other them as being these, magical sorts of lands of psychological well-being, because they're not. There's a lot of sexual abuse in, Tibetan Buddhist monasteries. There's still a lot of misogyny. There's a lot of emotional suppression that you experience. There's still plenty of issues in these societies, and I don't want put them on too much of a pedestal. But I do think that we can isolate certain aspects of really how all humans have lived since the dawn of our species that have now changed in the last 50 to 100 years. And there's some really significant changes that have taken place. There's some really significant changes in the way that we live our lives, the way that we relate with our neighbors and our friends and our family. And I think that it definitely it hampers our experience of happiness and our experience of just general well-being. But I don't really see how anyone can have a lasting experience of happiness in a capitalist society. If we're existing within this web of consumerism, where corporations are basically toying with our psyches to convince us that we don't have enough and we need more, then that's a recipe for disaster. That's the Buddhist explanation of suffering, at its core. As long as you're based in this sort of deficiency mentality where I'm not enough, I don't have enough, or I like this and therefore I need more of it, please give me more. It's a recipe for disaster. We're never going to be able to achieve any kind of personal fulfillment.
I think that's really well said. I think that's something that I hope this can become a bigger part of our national discussion with the coronavirus pandemic. Like just this, there's an emerging field of happiness studies. Like, what does it mean to be a happy, fulfilled human? How have people evolved to live? How can we create a life for ourselves that is in alignment with our biological reality, with our basic needs? And this thing, I read this fascinating study that was done of these Silicon Valley millionaires, and they interview these people, and they interview this guy who has, I think he's worth $10 million. He has a beautiful house, like overlooking the ocean, and he wakes up and works at 7 a.m. to 7 p.m. 5 days a week. He puts in these incredible work weeks, and he just can't stop, and he feels poor because his neighbors are so much wealthier than he is. But to the average person, he has more money than 99.999% of people on this planet, yet his psychological experience is one of, he hasn't made it yet.
Yeah, I mean that's the nature of things, right? I mean that's what we're taught in Buddhism pretty early on. You know, it's essentially it's the part of the defects of samsara, so to speak. It's, you know,
Mm.
the defects of cyclical existence. You know, we're convinced that once we get the thing, whatever the thing is in the moment, then we'll be satisfied, and then we'll be able to, you know, rest in ultimate fulfillment and joy and satisfaction. And it just never comes. It's always followed by the next thing. That's just the nature of the way things are. And it's bad enough when you don't have a consumerist, materialistic, capitalist society to try to engage with. But when you really look at the existential state of humanity right now in Western countries, using the term Western quite broadly there, because this also refers to quite a few Eastern countries and Eastern societies, and also Southern, you know, south of the hemisphere societies. But regardless, modern society, you know, it's that you go to work, you exert yourself for 40 plus hours a week, doing something that is usually non-essential, but is a way to make money, but is also primarily a way to make other people more money. And you do that day in and day out, and then afterwards you go home, you take in media which tells you to consume and buy things.
Mm.
You spend a bit of that time buying things, and then you spend a tiny amount of that time relating with other people.
Mm.
And overall, the balance is extremely off. And just the amount of time that we spend trying to make the money necessary to then go and buy the food and afford the house to live in is way more than the amount of time taken by people in hunter-gatherer societies to be able to secure the amount of food that they need that day.
Right.
They've done a number of studies on, you know, hunter-gatherer societies that we encountered in the last century, and the way that they live their lives. And they spend a fraction of the amount of time trying to secure food and shelter for the day than we spend working in order to achieve, or in order to afford shelter and food for the day. So
Yeah.
it's really, you know, we didn't win. The agricultural revolution didn't necessarily just give us positive circumstances. It gave us a lot of really novel difficulties.
Yeah.
Coronavirus also not being an exception to that. You know, these
Yeah.
sorts of pandemic infections are also a part of the agricultural revolution.
Yeah. Oh, I've been reading this book called Civilized to Death, and it's a
Oh, interesting.
fantastic book. But he tells the story of this anthropologist who was in, I think, Papua New Guinea, and he's living with this, you know, tribe that we would consider very primitive. And he's there for a year, and then he's leaving, and then he talks to, he's helping make a documentary film. He talks to the filmmakers, and he's like, "What if we brought some of these people back with us to London?" They actually went back to London, and they debated it, and they're like, "Well, we don't want to take them out of their world because maybe they'll get really depressed that they live in such a poor place, you know." But they're like, "Well, let's try it." And they took like 3 of them back, and they lived in London for like a month. And then and he talked to him, and he's like, he lives, you know, he's this like mansion, this nice house, but he goes to work every day, all day. And they're like, "Why are you leaving every morning when your family's here?" And he's like, "Well, I have
Yeah.
to work." And they're like, "Why do you have to work?" And he's like, "Well, you know, I'm still making payments on this house." And they're like, "Well, when will you own the house?" And he's like, "Well, it's a 25-year mortgage." And they like couldn't believe that. And they're like, "When one of us needs a house, we all get together and build it in a week, and then they have a
Yeah.
house." And they didn't
Right.
really see the difference between that and this guy's mansion. They were just like, "It's a house." And then all of them
Totally.
wanted to go back. None of them wanted to stay in England. They were offered that. None of them wanted to do it.
Yeah, I mean that's thoroughly unsurprising. I definitely personally I have fairly Luddite tendencies, and you know, part of me wants to run off and build a hobbit hole in the country. But I do also think that it's important for us to consider that technology is not something that we have to, you know, automatically reject and think of
Mm.
as being this really negative force. The reality is that we have the resources today, so where every human being on the planet, through technological advances, should be able to have enough food, have access to healthcare, and have enough resources to be able to survive comfortably. And I think really the ideal future that we should be moving towards is a kind of integrated technological utopia,
Mm.
which is entirely feasible. It's, you know, if we really do believe that we're on this upward trajectory and we're going to continue evolving and evolving, that needs to be what we're aiming for. Technology isn't going anywhere.
Mm.
But unfortunately, neither is capitalism right now. And that's ultimately what we need to focus on as being the principal sort of unfortunately evil at this point in time. Obviously, it's not going to solve all of our problems to just topple, free market capitalism, and then all of a sudden everything's fixed. But as it stands right now, most of the really major issues that we're seeing, including the distribution of resources very unequally across the globe and even within major first world societies, as well as climate change, as well as unequal access to healthcare and so on. This is really related to free market capitalism and neoliberal ideology.
Hmm.
So we need to really tackle that, especially as we're really on the threshold right now of this extreme revolution technologically. This really, according to like Yuval Noah Harari, who I'm a big fan of, who wrote *Sapiens* and *Homo Deus*, this is a revolution of the same caliber as the intellectual revolution and the agricultural revolution and the scientific revolution. This technological revolution is going to be the same sort of experience where it's going to completely revolutionize our very experience of life, and even potentially our genetic manifestation as human beings. We might very well in this century have superhumans that are able to live to 300 years old and be able to potentially have sort of superhuman abilities. This isn't actually science fiction anymore. It's scientific reality. So if we're not addressing that as part of our grand conversation regarding climate change, regarding income and wealth inequality, and so on, then we're really missing a big piece of the pie.
Yeah, I couldn't agree more. Yeah, I think it's certainly possible and worthwhile to imagine, like what you just said, a kind of technological utopia, or at least a better society, a better system. And capitalism is broken. We don't even really have capitalism. What we have is like a lot of government-sponsored corporate takeovers. And I mean, you look at the handouts and the bailouts, and it's not working. Like these bankers and CEOs that think that they're geniuses keep running us into the ground, and then they get bailed out. Like, how is that a success story?
It's not. It's very much not. But this was the ultimate endpoint. This was the sort of destined future of capitalism. If you look at Marx, if you look at what he wrote about, on the topic, we are in this, late stage of capitalism, and it's manifesting in very similar ways to how he had, projected. So I don't think we shouldn't be surprised that we're in the position that we're in, but we could definitely be a hell of a lot more rational and conscious of this position. And I think that there's a really strong place in that whole dynamic for Buddhism, for traditional medicine, for traditional understandings of what it means to be human.
Yeah.
And I think to ask some of those questions and really turn inward a bit more to be able to identify where are our most vulnerable points as humans right now, and what are the most important areas for us to be directing our attention to, and how can we protect our humanity in the face of what may be the final blow to Homo sapiens.
Yeah, interesting times. I mean, what do you think about the idea, while I have you, of having limited capitalism, like a limited free market for certain things, and then we take certain things like healthcare, education, food, like housing, and we take that out? That's not a free market thing, and that's kind of the situation we're already in. We already don't have a free market for most of those things anyway, but we think that we do.
I mean, I'm not a political theorist, so I'm not someone that's going to be able to construct a new sort of economic reality. But I do see a lot of problems with any system that involves the ability to extract resources and monetize them and profit off of them to extreme degrees. I think for any system to be able to succeed, there needs to be a cap on how many resources, how much money an individual can have. There need to be caps on which kinds of things can be monetized. There need to be, basic necessities covered for every human being worldwide. There needs to be a universal basic income. There needs to be universal healthcare, universal education. There needs to be guaranteed housing, guaranteed food, the basic necessities for being a human, which even in 2020, for a lot of people, that likely includes things like internet and cell phones and computers. When we look forward to a sort of technological utopian, imagined reality, we need to consider the fact that everyone needs to have access to this kind of technology.
Yeah.
As people talk about, Bitcoin and blockchain technology and decentralized finances, they need to remember the fact that not every person has access to technology to be able to access that.
Right.
You also need to consider the fact that, okay, then every single person needs to be given some sort of access to the internet and a device to be able to do that with. And in this day and age, that really needs to be treated as a kind of necessity if we're going to have resources that are only available through those means. But even on a more sort of mundane level, I think it's dangerous to give corporations the ability to come up with something and tell us that we need it and that we can't live without it, and then sell it to us by manipulating our psychological reality.
Yeah.
The fact that companies can use sex to sell their products, we think that we should be able to, look past that. We're too smart for that. We'll be able to see when that happens. It's just good fun. It's not a big deal. But humans are pretty fucking stupid. And I'm sorry for being really blunt about that, but it's really true. It's not that we're stupid. It's that we're very easily manipulated and very easily brainwashed.
Well, we're very easily addicted.
Yeah, completely. It's phenomenally easy to affect the way that another person thinks, and to get them to try something and get them to continue using something. It's just extremely easy. Any of us who have conservative parents, it's been amazing to see how successful right-wing media propaganda has been in affecting people's entire form of reality and experience of the world that we live in. And all it takes is, constant indoctrination and using the right words. When every time Trump says, like, believe me, believe me, I'm the best, I'm da 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 da, and he's just drilling it into people, that's effective brainwashing. That is, that is manipulation, and it is working. People do believe him when he says it, and we have to take that into consideration when we look at the future. Society, and especially the future of democracy. It really threatens the whole concept of democracy as an effective political system.
It's fascinating. Yeah, and I agree. And I think with Trump, we're really witnessing a cult of personality taking over the presidency in the United States, which we haven't really seen before in this way. It's a kind of a new thing, but we're very vulnerable to it. And people obviously have been vulnerable to it for a long time. It's happened all over the world.
Yeah. And I think it's especially dangerous, or it's especially probable in a place like the U.S. This is really off from the Tibetan medicine topic. But it's great. But when we have a system that is, it doesn't have any sort of monarchy, not saying that the UK has been any better at having a monarchy, but I do think that Trump was essentially elected king of America. That was what people wanted. They didn't necessarily want him to be making, mundane political decisions and, going through the minutiae of the day-to-day of political life. They wanted him to be the representative for America, which is itself ridiculous, repulsive, and absolutely just absurd. But I think we would be in a very different position if we had like an elected monarch or an elected head of state that's a figurehead who holds a position and is maybe a charismatic sort of figure that talks to the people. But then you have a prime minister that's actually dealing with the minutia of political decision making.
That's interesting.
But even with all of that, I just think that fundamentally democracy is reaching the end of its lifespan, and we're going to need a different sort of system if we're going to move forward. We can't have free market capitalism, media that can be corporate sponsored and owned, and democracy. Those things can't all work together. We have to get rid of at least one of them.
Interesting. Well, thanks so much for your time and for everything.
Yeah.
We covered a lot of different ground. We went more into politics than I thought, but do you have any last words you want to say before we close up?
I would just say that I think that we need to use this as an opportunity. And I think that's probably being tossed around a bit at the moment, and it's sort of getting diluted as a result of that. But we shouldn't separate out coronavirus from climate change, first of all. I think it's important that we don't just say let's take the momentum from coronavirus and then shift it over to climate change. I'm really stuck on capitalism right now. We need to see them as one and the same. You know, coronavirus ultimately arose from encroachment and desecration of a natural resource and animals, you know, abiding in that natural resource. So we need to recognize the fact that the increase in these sorts of diseases, again, 3/4 of new infectious diseases are zootrophic, and they're coming from animals, wild animals, usually, that we are destroying the environments of and then exposing ourselves to, thereby exposing ourselves to pathogens that we have no immunity to.
Right.
So this really is the result of climate change. This is one of the things that climate scientists have been telling us for years was going to be happening. You know, we can also look at, you know, the melting polar ice caps and the melting tundra that are releasing viruses into the atmosphere that haven't seen the light of day for millions of years. That's another thing that we know is going to happen, that
that's
we're
terrifying.
mostly prepared for. And it's you know, completely inextricable from our experience of climate change. So we need to recognize that they're the same, not just try to impose one on the other.
I'm really struck by that, and I agree. And I think we should start talking about this, like the response to coronavirus can be a response to climate change rather than seeing them as two separate things. And the climate change is the bigger thing. It's like coronavirus is a big thing, obviously, but climate change is what, like 1,000,000 times the size of that.
Exactly. And that's why we have to be so disturbed by the fact that the Environmental Protection Agency has had, I don't know what degree of how many of their sort of restrictions or their regulations they've been lifted from corporations, from industry in the United States. The EPA has been essentially stripped of their regulatory power in the wake of all of this until further notice by Trump's administration. But even looking at the issue that we're now facing as non-conservatives in America, where our heir apparent to the throne, our nominee, is very much not on board with the Green New Deal, is very much not on board with robust reactions to climate change and attempts to mitigate the effects of climate change on humanity. And that should really scare the shit out of us. That's a very serious problem. If we come out of this epidemic, which is going to have a human toll and also an economic toll, and if we come out of that only focusing on re-correcting and over-correcting on the economic side, by injecting massive amounts of money into financial institutions, by providing stimulus packages to corporations and big government, or big business, or extractive sort of industries like fossil fuels, then we're going to end up way, way, way worse off than we were going into this. We should really be aware of the fact that this has been a trope throughout human history, that tragedy usually falls right into some degree of fascism, and usually that's not benefiting the people at large. It's benefiting a small number of powerful individuals. So we're in a really risky position right now, and we can come out of coronavirus much stronger, but we also might come out of it in a much, 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 much more volatile position. And unfortunately, I think that's where we're heading.
It's scary. I'm honestly more scared of that and of climate change than of coronavirus per se, even though it is a terrible problem, and hopefully someone will get a cure for, a vaccine for soon. But some of the ramifications, the economic fallout, the political changes, it's a scary time.
And this is at the very least, I think the fact that we've sort of had the rug pulled out from under us and a lot of wind taken out of our sails as progressives in the US, or in the UK in my case. We had a very similar situation recently with the election of Boris Johnson. But I think that this also gives us the opportunity to think outside of the box a little bit and stop convincing ourselves that we're going to be able to instate lasting change from within the system. It's not going to work that way. And we need to take matters into our own hands on a lot of different levels. With coronavirus in the US, I mean, you guys are probably going to be dealing in the next month with a situation in which the government is no longer forcing lockdown, and they're no longer providing support for businesses or for individuals who are choosing to self-isolate. And that should really, really terrify people. At that point, you're confronted with a really significant existential existential and moral crisis. And you're going to have to be able to make some decisions at that point. But we're going to need good community organizing. We're going to need people to band together, and we're going to need people to make demands of the government and demands from corporations, and really not take any bullshit from them. So when we do that collectively, I think we can start to build some momentum for a real revolutionary change. And maybe it's actually somehow a good thing that we've, finally lost our last opportunity of some sort of real systemic change from the inside. I think now we can actually focus on creating change from the outside.
Thank you so much for listening. If you have found this podcast valuable, please consider supporting it by sharing it with your friends, posting about it on social media. Check out our website, astateofmindplay.com, to learn more about it, to get notes about each episode. And please make a donation to help support the work that goes into each and every one of these episodes. Patreon.com/astateofmind. Even $2 or $3 or $5 makes a big difference. And learn more about my work as a meditation teacher and therapist and coach at julianocean.us. And what is playing in the background right now is an improv jam I recorded the other night with our friend Stephen Newman. Please enjoy, and I will see you here next time.